Order. Call the Minister for COVID vaccine deployment to make a statement, Mr. Nadhim Zahawi.
Thank you very much, Madam Deputy Speaker. Can I begin by thanking you, and with permission, I'd like to make a statement on coronavirus. But before I do that, I'd like to wish my shadow opposite number a happy birthday today. Our nation, Madam Deputy Speaker, is getting safer every day as more and more people get protected by the biggest immunization program in the history of our health service. Over 10 million people have now received their first dose of one of our coronavirus vaccines. This is almost 1 in 5 adults in the United Kingdom. We're vaccinating at scale, while at the same time retaining a close focus on the most vulnerable in our society to make sure those at greater risk need are at the forefront of the queue. I am pleased to inform the House that we have now vaccinated almost 9 in 10 over 80s in the UK, almost 9 in 10 over 75s, and over half of people in their 70s. We've also visited every eligible care home possible with older residents in England and have offered vaccinations to all their residents and staff. This means we are currently on track to meet our target of offering a vaccine to the 4 most vulnerable groups by mid-February. This is an incredible effort, Madam Deputy Speaker, and has drawn on the hard work of so many. And I want to just take a moment to thank every single person who has made this happen, the hundreds of thousands of volunteers up and down the country, the scientists, of course, our colleagues in the NHS, the GPs, the doctors, the nurses, the vaccinators, social care, the manufacturers, the local authorities, the armed forces, the civil servants who work night and day to make this deployment possible, and anyone else who has played a part in this huge logistical endeavour. It really is a combination of the best of the United Kingdom. At our time of national need, you have given us a big boost at our fight against this deadly virus, which remains a big threat to us all. There are still over 32,000 COVID patients in hospital, and the level of infection is still alarmingly high. So we must all stay vigilant and keep our resolve, while we keep expanding our vaccination program so we can get more people protected even more quickly. Madam Deputy Speaker, we have an ambitious plan to do this. We're boosting our supply of vaccines, and our portfolio now stands at over 400 million doses, some of which will be manufactured in the United Kingdom. And we are opening more vaccination sites too. I'm pleased to inform the House that 39 new sites have opened their doors this week, along with 62 more pharmacy-led sites. This includes a church in Worcester, Selhurst Park, the home of Crystal Palace Football Club, and a fire station in Basingstoke, supported by firefighters and support staff from Hampshire Fire and Rescue Service. One of the greatest pleasures, Madam Deputy Speaker, for me over the past few months has been seeing the wide range of vaccination sites that have been set up right in the heart of our local communities. Cinemas, mosques, food courts, and so many other institutions have now been transformed into life-saving facilities, giving hope to people every day. Thanks to this rapid expansion, we have now established a major national infrastructure. There are now 89 large vaccination centres and 194 sites run by high street pharmacies, along with 1,000 GP-led services and over 250 hospital hubs. Today's announcement will mean that even more people will live close to a major vaccination site, so we can make vaccinating the most vulnerable even quicker and even simpler. Madam Deputy Speaker, we have always believed in the power of science and ingenuity to get us through this crisis, and I was pleased earlier this week to see compelling findings in the Lancet Medical Journal reinforcing the effectiveness of our Oxford AstraZeneca vaccine. It showed that the vaccine provides sustained protection of 76% during the 12-week interval between the first and second dose, and that the vaccine seems likely to reduce transmission to others by 2/3. This is, of course, really great news for us all, but we will not rest on our laurels. Madam Deputy Speaker, no one is really safe until the whole world is safe. Our scientific pioneers will keep innovating so we can help the whole world in our collective fight against this virus. I saw how wonderful and powerful this ingenuity could be when I was one of the thousands of volunteers who took part in the Novavax clinical trial, a trial that published very promising results a few days ago. Today, I'm pleased to announce another clinical trial, a world-first study that will help cement the United Kingdom's position as a global hub for vaccination research. This trial will look at whether different vaccines can be safely used for a 2-dose regime in the future to support a more flexible program of immunization. I want to just reinforce, Madam Deputy Speaker, that this is a year-long study and there are no current plans to change our existing vaccine program, which will continue to use the same doses, but it will perform a vital role, helping the world understand whether different vaccines can be safely used. Our scientists have played a pivotal part in our response to this deadly virus, and once again, they are leading the way, helping us to learn more about this virus and how we should respond. Madam Deputy Speaker, it has been heartwarming to see how excited so many people have been to get their vaccine and to see the work taking place in local communities to encourage people to come forward to get their jab. Honourable members, of course, have an important role to play too. I was heartened to see colleagues from all sides of the House coming together to encourage take-up within minority ethnic communities through a joint video which was posted on social media last week. 2 videos, I should add. The video rightly says MPs don't agree all the time, but on taking the vaccination, we do. I could not agree more, and I am grateful to every single honourable member who has come forward to support this national effort. We want to make it as easy as possible for colleagues to do so. This week, we published a new resource for honourable members that provides more information on the vaccine rollout and what colleagues can do to increase the take-up of the vaccine in their constituencies. This is an extremely valuable resource, and I would urge all honourable members to take a look at and think about what they can do within their constituencies. Madam Deputy Speaker, our vaccination programme is our way out of this pandemic. But even though this programme is accelerating rapidly, and as the Chief Medical Officer said yesterday, we appear to be past the peak, this remains a deadly virus, and it will take time for the impact of vaccinations to be felt. So for now, we must all stand firm and keep following the steps that we know make a real big difference until the science can make us safe. And I commend this statement to the House.
Thank you. Happy birthday to the Honourable Member for Nottingham North. Mr. Alex Norris.
Thank you, Madam Deputy Speaker. I'm grateful to the Minister for advance sight of his statement and for his kind words about my birthday and for yours as well. But of course, the gladdest tidings is the news that more than 10 million people have received their first dose. Once again, our incredible National Health Service has delivered for us. And I visited a site in Nottingham earlier in the week, and to see that team of the NHS, armed forces, local councils, volunteers and many more coming together was really an uplifting and a really incredible sight. And we welcome too today's announcements about the new clinical trial. It is clear that we will live with COVID-19 for a long time and indeed its mutations. So this is the best way to get out in front of it. And we were very glad also to hear the study results regarding Oxford AstraZeneca vaccine reducing transmission and maintaining protection over 12 weeks. Again, as the Minister says, it's very clear that vaccines are the way out of this pandemic. Daily cases are now beginning to fall, but it is vital the government doesn't repeat previous mistakes and take the foot off the gas just as things look to be getting better. I wonder whether the Minister could update us on if he expects similar trial data to be published for the Pfizer vaccine. The government seems on track to deliver on its promise of vaccinating the top 4 JCVI priority groups by the middle of this month, and we really welcome this, and I commend the work of the Minister in this regard. But in the spirit of cooperation, just need to press on a couple of points about what comes next. Firstly, regarding data, we're all very concerned about the reports of lagging take-up amongst Black, Asian and minority ethnic communities, as well as poorer communities. And I would associate myself with the comments about the brilliant work done by our colleagues to fight this. Because what we know about the pandemic is that it's these groups that have been worse affected. We need them to take up the vaccine. But I'm conscious that much of what we hear is based on anecdotal stories rather than hard data, particularly at a community level, split by ethnicity. I wonder whether the Minister could say what data he has in this regard and when colleagues can get council ward level data so that we can all be part of this effort to drive up take-up. And also, as the first phase is coming to an end, could the Minister update on the number of care home staff who have received their first dose and what the plan is, perhaps to encourage those who haven't to take it up upon second reflection? And regarding second doses, when we get to the beginning of April, we'll start to have those who had their first dose expecting and needing their second one. So what assurances could the Minister say around there being enough supply to ensure that everyone who's due their second dose gets it, as well as obviously managing those who are due their first one? The Foreign Secretary wouldn't offer this commitment on behalf of the government recently. I hope the Vaccine Minister will be able to. Colleagues have raised with me that constituents who have received a national letter and called 119 to book are not routinely being offered local PCN-based options. Could the Minister confirm that this should not be the case and that he would welcome examples of where this is happening so that we could change that? Now, we as an opposition fully supported the government in prioritising those at the greatest risk of dying in those first four categories. But as we move on to categories 5 to 9, it is reasonable to ask the JCVI about including key workers. Data has shown that those who work closely with others and are regularly exposed to COVID-19 have higher death rates than the rest of the population. By prioritising these workers alongside the over 50s, 60s and people with underlying health conditions, we can reduce transmission further, protect more people and keep the vital services that they're providing running smoothly, including reopening of schools. So putting the politics of this to one side, we raised this suggestion over a week ago now. Could the Minister say whether he has had those conversations with the JCVI or if he would at least commit to asking them to look at how this might work as a suggestion? Madam Deputy Speaker, it is HIV testing week. Those living with HIV are in category 6. If their doctor knows their HIV status, then they will have their opportunity as planned. However, some choose perfectly legitimately and for some very profoundly important reasons to access their healthcare through other means, such as an HIV clinic. And their doctor, therefore, may not know their status, and they may well be missed out. In this very specific case, would the Minister commit to having a look at what may be a possible work around this? Allowing HIV clinics to connect them directly would be one such way, but we would support any effective way of doing that. And then finally, given that it's World Cancer Day, I wonder what consideration the Minister has given to vaccinating household members of the clinically extremely vulnerable to give another layer of protection to blood cancer patients and other CEV people, an argument I think strongly supported by the reports that transmission is reduced by these vaccinations. So to conclude, Madam Deputy Speaker, this programme really is the light at the end of the tunnel. Our NHS has delivered and we must support it to continue to do so by making the right policy decisions. Thank you.
Minister.
Thank you, Madam Deputy Speaker. I'm grateful for the honourable gentleman and his constructive way of engaging with the vaccination deployment programme. On trials, we have 2 trials running currently. The Vivaldi trial, both with Public Health England, which is testing residents of care homes, which were in category 1 of the JCVI categories, and the second is Siren, which is testing frontline health workers who are in category 2. And as Jonathan Van Tam, the Deputy Chief Medical Officer, said, we will know in the next few weeks the data from those trials, both in terms of infection and transmission. And of course, the Oxford data is very promising. It needs to be peer reviewed. But those trials will then also capture the Oxford vaccine, because obviously that came from on side in January. In terms of the priority list, the JCVI looked very closely at both BAME and, of course, other considerations, including profession, and came down very clearly on the side of age as the deciding factor in terms of people's risk of dying from COVID. This is a race against death, hence why we've got the 9 categories which we are going through, and we will continue to do so. Now, a number of professions will be captured in those categories. Of course, those who have severe, extremely severe illness will be captured in category 4, the severely, extremely vulnerable. And then, of course, others will be captured in the further categories down the phase 1 list. I certainly think it would be wrong to change the JCVI recommendation, because that 1 to 9 is 99% of mortality. I think when we get into phase 2, then we would welcome a debate, and of course ask the question of the JCVI as to whether professions like teachers, like shop workers, like police officers, who through their work will come into contact with much greater volumes of the virus than others do, and they will then advise us accordingly. On BAME and ethnicity, the NHS now collects the, obviously, ethnicity data, and we're publishing it. We're doing an enormous amount of work across government, but also with the NHS, to make sure we bring in local government so that we can begin to share data with local government. And I am, for one, would very much welcome us working much more closely with local government, between the NHS and local government, so that we can identify, to individual level, the people that we need to reach to protect as soon as possible. I want to see CCGs sharing data with MPs. I want to put that on record. I've had a number of colleagues who, including, I can see Madam Deputy Speaker, nodding away vigorously, that the CCGs should and must engage with local politicians, because actually MPs get a lot of the emails and the telephone calls from concerned constituents who happen to be in those top 4 most vulnerable categories. And of course, the NHS has plans to publishing CCG level data very soon. In terms of care home staff, he asked about, we had a fantastic response, obviously, through the care home vaccination program, which is because it's category 1. And we continue to do more with staff to encourage them to be vaccinated, not just on the return visits, because we have 4 visits into care homes. Visit 1 is for the first dose. Visit 2 is to try and vaccinate those who may have been infected, because you can't vaccinate them until after 28 days. And visit 3 would be second dose, and so on. So we're getting greater traction with care home staff, but he's quite right to mention that. And there's a big focus on helping them go to hospital hubs and, of course, through their primary care networks. In terms of second dose, everyone who's had a first dose of Pfizer will get a second dose of Pfizer within that 12-week dosing period. It'll begin in March in the usual way that NHS does vaccination. This will also happen. Everyone has had a first dose of Oxford AstraZeneca will get a second dose of Oxford AstraZeneca within the 12 weeks as well. In terms of people wanting to the option of either going to a national vaccination centre or to PCN, absolutely right. And if there are cases that honourable members have, please point them to us, and we will do everything we can to make sure that that is facilitated if they're unable to. On his, I think rightly highlighting the HIV clinics, I will take that away and see whether we can, there's a workaround for those who want to remain, have that information remain private from their GP. Then we see what we can do. And again, I would share with him that this is World Cancer Day, and there is now a real excitement in the scientific community in the UK because of the messenger RNA vaccine to begin to think about vaccines for cancers as well. But he raises an important point about those who care for the clinically extremely vulnerable. And we want to make sure that we deliver the JCVI phase 1 and very quickly reach the rest of the population as well.
Now we go to the chairman of the Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. And can I congratulate the Minister for his leadership of the vaccine rollout programme, which really is one of the most impressive anywhere in the world, and indeed commend the Health Secretary for the foundations that he laid for this last year. I wonder, now that we know that mutations and variants are really the name of the game, if I could ask him about a worst case scenario, which is that we see a variant that is wholly immune to the vaccines that we are currently distributing. How possible is it that we could see that in the next few months in the UK? Has the Manaus variant from Brazil, which I know people are particularly worried about, arrived here? And if we did see such a variant, what is the timescale, not just to develop a new vaccine that works against it, but also to manufacture it and get it approved by regulators so that it's ready to go?
Minister.
I'm grateful for the chairman of the Health Select Committee and his question. He's absolutely right. So the manufacturers are already working on variants to their vaccine to take into account the mutation of the virus. Viruses will mutate to survive, and this virus is no different. There are about 4,000 mutations now around the world, some more concerning than others. We have in the United Kingdom a genome sequencing industry that is a world leader. About 50% of the sequencing has taken place just under in the United Kingdom. And not only are we working with the current manufacturers of Pfizer-BioNTech and, of course, AstraZeneca and Moderna that have been approved, but we're also looking at how we can make sure that we make the most of this new messenger RNA technology, which allows us the rapid development of vaccine variants that would then deal with the virus variants as rapidly as possible. And I spoke to the Science Select Committee a few weeks ago when I said we were planning to have in place the ability to go from the moment we can sequence a variant that we are really concerned about to the moment we can have a vaccine ready to be between 30 to 40 days, and then, of course, the manufacturing time. We've invested in both Oxfordshire in the VMIC, the Vaccination and Innovation Manufacturing Centre, and in CGMIC in Braintree, 127 million in there, just shy of 100 million in Oxfordshire, to be ready to manufacture any vaccine that we would need. And of course, the Prime Minister also visited what I refer to as our 7th vaccine, which is the Valneva vaccine. That's a whole inactivated virus. So it doesn't just work on the spikes in the way the current 2 vaccines that we are deploying works. It works on the whole of the virus, which is much more likely then to capture any mutations from the spikes and therefore be incredibly effective. We've invested in that production facility in Scotland so that we can have that vaccine as a future proofing of sort of annual vaccination strategies or a booster in the autumn if necessary.
Thank you. Now we go to the SNP spokesman, Neil Hanby.
Thank you, Madam Deputy Speaker, and I thank the Minister for the advance sight of his statement. I'm glad to hear the Minister's recognition of the importance of adherence to the clinical categories of the JCVI, and I would also like to give my thanks on vaccination teams in my Kirkcaldy and Cowdenbeath constituency across Scotland and indeed these islands. However, I would urge the Minister to think more lightly of himself and deeply of the world. Over recent weeks, the UK government and their allies in Scotland have quite disgracefully been attempting to sow fear in the minds of our vulnerable communities that vaccine deployment is too slow. That narrative was completely debunked yesterday, yet the PM still claimed we have today passed a milestone of 10 million vaccines in the United Kingdom, including almost 90% of those aged 75 and over in England, and every eligible person in a care home. However, today on Good Morning Scotland, the Undersecretary for Vaccine Deployment was further pressed how many vaccines have been given, not offered, but given to people in care homes in England. Even with 24 hours warning and following a detailed probing, he was not able to offer more than a vague 91% of those eligible in an ill-defined subset before settling on a very high number and suggesting care home staff's vaccination may not have yet begun in England. Can the Minister tell us today what percentage of all care home residents and all care home staff have had their jab in England, and if not, why not? And Madam Deputy Speaker, I would like to return to the JVCI clinical prioritization, if I may. In a recent written parliamentary question to the Minister regarding the clinically extremely vulnerable, he chose to regurgitate JCVI guidance rather than answer the question. With the encouraging news that the Oxford vaccine and potentially others have a measurable impact on transmission, can the Minister update the House on what steps he has taken to ask the JCVI to review current guidance for household members of the clinically extremely vulnerable, such as people with blood cancer or organ transplantation, and thus provide a vital layer of protection to those who may not be able to receive the vaccine themselves?
Minister.
Thank you very much, Madam Deputy Speaker. I'm grateful for the honourable member's question, albeit I don't recognise his description of our collaboration, dare I say. We have, over the past 2 weeks, been working solidly. The British Army, the armed forces, have been working to deliver 80 vaccination sites in Scotland and hand them over to NHS Scotland within 28 days. And that work began a couple of weeks ago. So I hope he recognises the effort that the United Kingdom is putting, not just in supplying the vaccines for Scotland, for Wales, Northern Ireland, and for England, but also the way we're trying to support the vaccine deployment in Scotland. Of course, last weekend was our target to make sure that every eligible care home in England, over 10,000 care homes, have actually been visited and received the vaccine. Only a handful of care homes who had were deemed to have an outbreak weren't visited, and we did, the NHS quite rightly, celebrated actually achieving that target last week. And so I'm slightly saddened in a way that there's this sort of politicking between ourselves here around this issue. And we continue, as the Shadow Minister just asked me, to work very hard to make sure that staff in care homes are also offered the vaccine on those visits, and also actually an opportunity to be vaccinated in their primary care networks and, of course, in hospitals. As far as the JCVI, those who are clinically extremely vulnerable are in category 4, and we will vaccinate them by mid-February.
Now we go to Scunthorpe, to Holly Momby-Croft.
Thank you, Madam Deputy Speaker. Will my right honourable friend join me in thanking local health teams and volunteers for their incredible vaccination efforts that we've seen in North Lincolnshire? I know they are keen to deliver even more. Can he give an update on the progress he is making on increasing weekly vaccine supplies? Thank you.
Minister.
For my honourable friend's question, I will certainly join her in thanking the teams that have been working in North Lincolnshire and delivering. These are extraordinary people doing really incredible work, and I want to thank them from the bottom of my heart. We try as hard as we can in the team to make sure we give as much notice to local teams as to when they're getting their delivery. So this week, yesterday, Wednesday, everyone would have had notice of their deliveries for next week. We want to give as much notice as possible. Our limiting factor remains vaccine supply. It is becoming more stable. We have greater visibility of vaccines all the way through to March, hence why our confidence in meeting our targets. I can reassure her that her local teams will get the vaccines they need to meet the mid-February target of vaccinating the top 4 cohorts for that date and protecting them.
Now we go to Twickenham, to Munira Wilson.
Thank you, Madam Deputy Speaker. It was an immense privilege to visit the Stoop in Twickenham this morning, home to Harlequins Rugby, which opens today as a local mass vaccination hub. The NHS, Quins and the Council have done an incredible job to be in a position to start vaccinating 500 people a day. The Minister has spoken quite a lot about care home staff and some of the challenges in driving uptake among those staff, but we know that domiciliary care staff are also lagging behind in terms of vaccination rates. One industry survey suggested only 32% had been vaccinated so far. So can I press the Minister again? What are the latest vaccination rates for both care home staff and home care staff? What are the reasons for this lag, and how can we best work together to address this problem?
Minister.
I'm grateful for the honourable lady's question. It's great to hear the Harlequins joining the fight, as they always do, when it comes to the United Kingdom actually getting people protected and vaccinated. The care home and domiciliary staff are both in our priority list, as she knows. We are working with local government, and David Pearson, who is a champion, of course, of the social care sector, has been working with local government to identify the best way to identify domiciliary staff is through local government, because a lot of people will be with agencies, and as you quite rightly pointed out, hard to reach. They are in our target. They are part of the top 4 categories with those who are caring for the elderly in residential care homes, and we will meet our target of offering them a vaccine by mid-February.
And now to Wrexham,